Hi, I'm your host, Marsha Florence with Just Dance. Today our show is the City of Detroit Health and Wellness Promotions. Hurry back and join us. Hi, I'm your host, Marsha Florence with Just Ask. Today our show is the City of Detroit Department of Health and Wellness Promotions, and we have with us Dr. Calvin Trent. Good morning, Dr. Trent.
Good morning, Marsha. Pleasure to be with you.
Thank you so much for coming.
Thank you for having me.
Okay, now Dr. Trent, you know what, I understand that there's a series of wonderful events that's coming up, and we wanted to start off with finding out about you and the service that you provide with the City of Detroit before we get to those events.
Great.
So tell us about promotions with health and wellness for the City of Detroit.
Okay, well, I'm, as you said, Dr. Calvin Trent, and I am the general manager for a division of the Department of Health and Wellness Promotion called Special Populations Health Services. And I'm directly responsible for dealing with the problems of HIV/AIDS and substance abuse in Detroit. A big responsibility that, you know, is very comprehensive and something we need to work on. But the Department of Health and Wellness Promotion is our city health department. Okay. And we have a myriad of services with the health department. Besides special populations, we also have environmental health services, which includes dog catching. Wow. You know, that's one of the things. Restaurant inspections, making sure that the food and air within the city is healthy for the citizens. We also have community health services, which provides communicable disease, STDs. We have maternal infant health care. We have the WIC program. We have pharmacy. We have a full range of medical services for our community.
So let me ask you this. So when a person goes to, and your facility is the Herman Kiefer location, right?
Yes.
In the city. Okay. So when people go to Herman Kiefer, they always get this misconception that when they go to Herman Kiefer, they're going for venereal diseases of some sort. But you guys are a conglomerate of services that people can get.
Yeah, practically every health service that you can think of.
Okay, because you guys got a real long name too. I only gave half of it, so I only said the health and wellness promotion. What is can you give me the full name of what it is?
Well, it is the Detroit Department of Health and Wellness Promotion. Okay. And that's a significant change. It was just the Department of Health, but we added wellness promotion. And I think that's a very important piece because it's not always just your health, but we're looking at people to be sure they're well. And that means, proper exercise, proper nutrition, making sure we have a big problem with obesity. Okay. And so many of the problems that people have are because they're not attentive to their wellness. Okay. And proper wellness then reflects on your total health. It's our responsibility to protect the health and safety of the citizens in our community. Every county has a health department, and every citizen in the state of Michigan should really be aware of the services that are provided by the health department.
Every county has a health department, but the city of Detroit is different, right? You guys, it's not just the health department by the county. You guys are operated by the city of Detroit, or what is it?
Well, yes, we're a function of the city, but most of our funding comes from the state of Michigan.
State of Michigan, okay,
right.
Okay.
So most health departments are also federally and state funded. Like in my division for substance abuse, we are the Medicaid insurer for substance abuse.
Okay.
So any person in the city of Detroit that has a substance abuse problem that needs treatment can get it from us free, and we are the Medicaid provider.
Okay.
But we also provide the service for individuals who have no insurance at all. Right. So if you have a substance abuse issue and you don't have insurance, then you need to come to us to get care.
So you know, after today, when they see this program and they know that they don't have to have insurance,
Oh, right.
the floodgates are open.
Well, that's what the health department is for.
Okay, and that's a good thing, because I think people always assume that you always have to have insurance. I mean, the fear of not knowing what's wrong with you is one thing, and then saying, well, I don't have any insurance to go find out,
Right.
is another. And so they will, that person will continue to go on with that ailment, thinking that I don't have no insurance, they're not going to see me no way.
That's right.
Okay.
And you know, you should always contact your local health department to see what services are available. In Detroit, we have not only a primary care clinic in the Herman Kiefer facility, we also have 2 other community clinics, and we also have clinics in schools. So we have health clinics in the schools, and we have clinics, and they don't require insurance.
Wow. I don't think a lot of people know that, Dr. Trent, and I'm sure after today that news will be spreaded, you know, by way of you giving it out, and they'll appreciate that. The viewers will appreciate that, because really, even I'm under the assumption that you got to have something just to go to, you know, the general clinic to find out if you're okay.
No.
And you could be a single parent struggling, and you feel like, you know, I can't take my baby, or I can't go myself, and you know, we'll be all right. You know, you can always say, I put it in God's hands. It is in God's hands, but these wonderful people like yourselves with this free service are making it even more easier for that person not to have fear in knowing what's wrong.
Right. It's not free. It's free for the person coming.
Okay.
But, you know, we are funded, like I say, through our local government in the city of Detroit contributes to the health department, and state and federal sources too. So we you know, we have a pharmacy. But you know, it is important. Communicable diseases. You know, we're responsible for looking out for TB in our community, for syphilis and the other sexually
STD,
transmitted diseases.
Stuff like that.
And you know, we have a lot of services for the elderly and the disabled. And you know, so we are primarily responsible for, like you say, diabetes in our community. You spoke about that earlier.
Yeah.
And so, you know, the health department has such a broad range of responsibilities and services that it's really incumbent upon citizens to get to your local health department, to get their brochures, to find out what the services are that they provide, because there's many services that you can get at the health department.
Now, the division or population that you serve in particular, what is that?
Well, I have 2 major responsibilities. One is for the prevention treatment of substance abuse issues, and working on recovery for people who have had substance abuse issues.
Okay.
You know, substance abuse and drug addiction and alcohol addiction, and we also have tobacco addiction, are very serious health issues in our community. They're not only serious health issues, they're serious public safety issues. You know, many times when people are addicted, you know, they get involved with the criminal justice system. They become
It's a snowball.
they become bad behaviors in the community, as well as sick individuals. And many times, because of their behaviors, they also perpetuate other illnesses within the community. And so, you know, and it's substance abuse addiction is a tragedy for our families and a tragedy for our communities. And my division makes sure that people understand that recovery from addictions is not only possible, it's a reality. And that with the proper support and the proper clinical services, people recover every day.
That's wonderful. Do you guys have volunteers? Do you take in volunteers?
Oh yeah, we have a part of our substance abuse division includes something called the Partnership for a Drug-Free Detroit.
Okay.
And the Partnership for a Drug-Free Detroit is a community coalition that we help support that community coalition, and it is totally made up of volunteers. There is some paid staff, but they promote prevention, particularly in the community, particularly with our young people. You know, it's such an important message for young people to not get involved with drugs. If there's one thing that can really ruin the life of a young person, it's getting involved with drugs at an early age. The kid that gets involved with drugs has such a opportunity, a bad opportunity, you know, to be involved in negative behavior eventually getting in touch with the criminal justice system. And even on the our biggest drugs of choice for our kids are marijuana and alcohol, actually.
Okay.
And many people poo-poo like alcohol or marijuana and kids. Oh, so a kid has a beer or whatever.
Right. But you can start them off by giving them the beer too young and making the mistake of allowing the child to have a beer and say, oh, it's just a beer, and they actually take on this enjoyment of that taste and acquire a beer or want to have a beer. Yeah, I think parenting, has a way of going haywire sometime when a parent doesn't realize that the effect of any type of drug can take precedent as early as 0 in age. So if it's having a child in a room while you're smoking marijuana, or if it's having a child sip a beer while you're holding him or her in the lap and they're 2 years old, you don't think that child will acquire a taste or sustain to those methods, but they can because you gave them early on chances to find out about stuff like that.
That's correct. And and the thing is that particularly with marijuana, one of the things that we found out recently, we've known it, but we're paying a lot of attention to it with the youth, is that 80% of the employers in our community test their prospective employees for drugs. And we're having a situation where 50% of the young people going for jobs are failing the drug test.
Right.
It's one thing to have a health issue. It's another thing to also have an employment issue.
Okay. I think it's wonderful now that we actually are drug testing, at the early stages of employment, so that even if you can pass the written test, now the next stage is, can you pass the drug test?
Yeah,
and if you pass the drug test,
but
then you're in the ballpark.
So many folks don't think about it. They think about the written test, and all of a sudden they say, oh, we're going to test you. And they've been smoking marijuana.
Well, that's what they call.
And that's the one drug that they're catching everybody on, and you don't get the job.
That's what they call weeding out the undesirables. Okay. Okay. Dr. Trent, we're going to take a break, and we'll be right back with some more information about the City of Detroit health and wellness promotions. We'll be right back.
Do you know that stroke targets by color? If you're African American, you're twice as likely to suffer a stroke as white Americans. Join the power to end stroke at strokeassociation.org.
And welcome back to the second half of the show. For those of you who are just not joining us, we're here with Dr. Calvin Trent, City of Detroit Department of Health and Wellness Promotions. Now, ladies and gentlemen, Dr. Trent just enlightened you with some information about what the health department does besides see individuals in reference to venereal diseases. I mean, did you hear about the pharmacy? Did you hear about the food department, where you can talk about diabetes or get proper care if you not only just own a restaurant, but you want to know about how to eat, what to eat. Is this contaminated? How do I stop it from being contaminated? Different departments that will give you insight on services that you need are at the Herman Kiefer location. And don't just say to yourself, well, all they do is one thing. They do a conglomerate of information. So you want to go there or call there, and we're going to give you the numbers, and check out the services that the department offers. And you can also tell them, I just saw Dr. Trent on Just Ask, so I know you got this here. Okay. Had to tell them that, Dr. Trent, because a lot of people will be surprised when they see this program to know that they can go there for so many wonderful things. Okay.
And their local health department.
And their local health department.
In Detroit, our local health department, but every community has a health department affiliated. In the county, we sit in the county, and Wayne County has a health department.
Right.
Get the resource, get the number of your health department,
okay,
and call your health department and see what services. They're there to serve the community, the health of the community.
Now, we have some numbers, so what numbers do you have?
Well, for the city of Detroit, if you want to call the Department of Health for general information, you can call 313-876-4000. That's 313-876-4000. Okay. Now, if you want to speak particularly to substance abuse, and if you want to talk, ask any questions about that, you can call 313-876-4562.
Okay. Give us that one again.
313-876-4562. Any information that you need about substance abuse prevention, treatment, or recovery.
Okay. Now, I know you guys, I'm going to give this number out because it's a brochure tied with this called Tired of Suffering. Now, I want to get a shot at this brochure because this one in particular caught my attention. Tired of Suffering. And you have a 24-hour access number to individuals who are tired of suffering. Okay, and that
from
number
substance abuse.
From substance abuse. Let me get that right. Okay. Okay, so for the Detroit residents, it's 1-800-467-2452.
That's correct.
1-800-467-2452. And all other Michigan residents outside of the city of Detroit, it's 1-888-736-0253. 1-888-736-0253.
Right.
Okay. So we want to get that right. So Dr. Trent, let me say this. If someone receives this brochure, Tired of Suffering, what information would they get out of this?
Well, what they're going to get is what are the treatment services that we provide for people who have substance abuse issues. You know, it's really unfortunate that so many people don't know that addictions to alcohol and drugs are treatable diseases, and that they're very susceptible to treatment. And if families, if parents, if spouses, can get their loved one, to come to services, then those services are very effective. And so we encourage every family, because throughout our state, almost every family has somebody affected with an alcohol or drug problem.
That's true.
And it's not only illegal drugs, but now we're having a lot of problem with prescription drugs. And so it can be a life and death situation.
Wow.
We have a lot of drug overdoses that end up in people's death. We have, of course, a lot of traffic accidents associated with alcohol. And so, it's really important to get your loved ones some service. And those numbers...
Let me ask you this. I'm sorry to cut you off, but can someone be educated on properly how to take medication? Lately we had a rash of entertainers in particular that mixed a cocktail or two together and accidentally, come to their demise. And so is there a program or such a service that the health department can teach a person how to properly not to mix?
Well, our pharmacy, and that's what pharmacists do. Our pharmacies, we have a pharmacy at the health department you can get through to on that number. But also your local pharmacy or your CVS. One of the things, if you are taking a prescription medication, you need to talk with your pharmacist to make sure that they know everything you're doing. So many times, the elderly particularly will be taking prescription drugs and not necessarily informing their physician or their pharmacist. They're also drinking a 40-ounce, or
That's true.
Which is another drug.
Elixir, that's right.
So it's best to be totally honest with your pharmacist also. And many times, some of the actors that you've talked about or celebrities are drug shopping. So they're, it's not that the one doctor prescribed them the medication. It's that they have a problem with addiction in their drug shopping.
Well, I'm just glad to know that you can talk to your pharmacist, as well as you can go to the Herman Kiefer facility and tell the pharmacist, I'm taking 5 different medications.
What's the effect of this? It's so important, drug interactions.
Now, I like this brochure, Directory of Services. That means, what is this, Dr. Trent?
That means that those are all the services that are involved in the health department. And that brochure opens up to be about this big.
Oh, yeah, I'm just going to do that.
I mean, we've got so many services for everybody. Services for the disabled, services for children, services for pregnant women, services, for your house. One of the big issues we have is lead poisoning in children. So we have just a myriad of services. Like I say, if you call 313-876-4000, you can inquire about the services of the health department and get the brochure mailed to you.
Okay, that's good, because we really need to know things like that. Now, this Partnership for a Drug-Free Detroit?
Partnership for a Drug-Free Detroit is the coalition I mentioned that is our community coalition that works on issues. And if you want to volunteer, if you want to be a part of the solution of drugs in our community, then we encourage you to also call our general number and inquire about joining the Partnership for a Drug-Free Detroit.
And your general number again is?
313-876-4562. 4562.
Okay, and the last brochure I'm going to bring up, this big booklet here, Bureau of Substance Abuse. See, that's that wonderful name I was talking about. Bureau of Substance Abuse Prevention, Treatment, and Recovery.
Yeah, prevention. Well, that one there is, you know, we are, anybody that has Medicaid, of course, you can get services from the health department. Dental services, primary care services, substance abuse services under your Medicaid eligibility.
Okay.
So this is our Medicaid handbook.
Okay.
So everybody that has Medicaid, we mail this out to them to make sure that they understand that they have free services through the health department through their Medicaid insurance.
Okay, wonderful. And I thought that was the last one, but I had one more good one.
Yeah,
Returning Citizens Public Health Center.
Yeah,
okay.
Well, one of the big issues that's going on in our community now is that that the Michigan Department of Corrections and many prisons across the country are releasing nonviolent drug offenders back to the communities.
Okay.
And so we're having a lot of people who were in prison coming back to the communities. And sometimes they might pose a health issue. You know, we have a lot of HIV in the prisons. We have a lot of, but then when those citizens come back, they need a place to get resources from. So we have at the Detroit Health Department a returning citizen center for folks coming back from prison. So if you have a loved one coming back from prison and they need services, housing, employment, then give us a call again at the health department.
Wow.
And we can
I'm telling you, Dr. Trent,
there.
you have brought in a wealth of information that a lot of our viewers are unaware of, and I know for sure, ladies and gentlemen, you don't have to call us here at Just Ask. You can actually call the numbers that Dr. Trent has provided, as well as if you're tired of suffering, substance abuse 24-hour access line. That number, once again, is 1-800-467-2452. And other Michigan residents outside of Detroit is 1-888-736-0253. Now, you know, I'm sitting here listening to you, and I'm just overwhelmed with the fact that, hey, I know now that I can come there and scout and get much as information as possible and spread the information and services to others that really are stumbling in our state trying to find out where to go, what to do, and saying to themselves, no one will help me.
Well, your local health department can help you with a lot of things, even birth certificates, death records, you know. So it's like I say, it's very important for any citizen to find out what their local health department provides them. And then, of course, there's a Michigan Department of Community Health. So there's a state health department, too. And you can go to www.michigan.gov and find out information about the state health department and what services you can get from them too. So, you know, our health is our most important asset, you know, and protecting our health and the health of our families and our communities is what the Department of Health and Wellness is all about.
Wow, Dr. Trent. I don't know what to say, because really, like I said before, you covered the whole, you know, gamut of what services are available, and no one should be left out. You know, I mean, you're having a child, a new parent, single parent, ex-offender program coming out of the incarceration system, elderly services.
Well, one we haven't mentioned that much, and I think we should, is our HIV services. You know, and another one that we're very interested in terms of children too. And you know, it's unfortunate now that, you know, being a senior citizen, when I came up, you know, sexual behavior was not life-threatening. You know, but now our sexual behavior is life-threatening. And it's something we have to talk to our kids about. It's something we have to protect ourselves about. And so through our HIV and AIDS programs, we want people to know that they should always be protecting themselves against this very deadly virus. And that, you know, we are into condom distribution, we're into education, we're into getting people tested. We think every person should be tested for HIV at least once a year. And to know if you're sexually active, if you're between the ages of 13 and 63, and actually if you're over 63. Because a lot of people don't seem to understand that, you know, that senior citizens are sexually active too. You know, but right now we're seeing, at least in the city of Detroit, an increase in HIV infection in people between the ages of 13 and 24. And that's very disturbing. And so, you know, the message has to be got out there to all, in every community. It's not just Detroit, it's every community, that you need to protect yourself in your sexual behavior. Yep. And understand the issues around HIV and AIDS.
Knowledge is the key.
That's correct.
Knowledge is definitely key. Okay. Well, ladies and gentlemen, we're going to go to our community commentary from one of our local community leaders in the city of Detroit, Mr. Andre Johnson of Detroit Recovery Project. Take it away, Andre.
Thank you, Marsha. September is National Alcohol, Drug Addiction Recovery Month. And what does that mean? That means that people all over the United States is recognizing September as National Recovery Month for members of the recovery community. Not only for members of the recovery community, but people who work day in and day out trying to help people overcome alcohol, substance abuse, drug addiction. People who are working and who are part of the treatment provider network in the state of Michigan. This is a time where we celebrate recovery. We celebrate victory. We show the community that recovery is possible and that treatment works. Recovery Month is an opportunity for the business community, the church community, corporate community, just regular community folks to come together and rally and support the recovery community. The recovery community supports you. Why? Because when people are no longer using alcohol and drugs, they become productive citizens of our community. They also are a very integral part of the quality of life in our community. So you would rather support a person in recovery rather than support somebody who is actually out there using. But recovery is possible. I can't reiterate it enough. September is National Alcohol Drug Addiction Recovery Month. If you're interested in information as it relates to that, you can always call our office, 313-876-4048. That's 313-876-4048. If you're interested in going on the website, you can check Recovery Month, www.recoverymonth.gov. www.recoverymonth.gov. We have exciting events and activities that's going to be held in our city of Detroit this September in honor of National Alcohol Drug Addiction Recovery Month. Now back to you, Marsha.
And thank you, Andre. Well, ladies and gentlemen, you've heard a wealth of information today. So if you have any questions for Dr. Trent or for Andre Johnson, please take note to the numbers that you see below the screen. Or if you want to contact me at Just Ask, our number is 248-988-0250, 248-988-0250, or drop a line to the web, justasktalkshow.org. I'm your host, Marsha Florence, and what do I always say? If you know someone with a disability or if you just have a general question, don't be afraid to ask. Just ask. I'm your host. Thank you.